Few understand how crazy the brain is, and widespread ignorance of Wernicke's aphasia proves it. It all began when Carl Wernicke had a patient with him a brain lesion. He used to speak a lot, but nobody understood what he was saying. This marked the beginning of the discovery of what is now known as Wernicke's aphasia. There are many types of aphasia. Aphasia means that you have a language disorder that could make it hard for you to read, listen, write, and say what you mean to say due to a cerebral lesion. The most common cause is stroke, although it could also be due to traumatic brain injury, brain tumors, among other causes. There are many types of aphasia, which vary greatly in their symptoms, depending on the location of the injury. Wernicke's aphasia is classically associated with a lesion in Wernicke's area, which corresponds to Brodmann area 22. Though Wernicke's area is more complex than what was previously presumed and usually taught, which I explained in detail in this video. In the case of Wernicke's aphasia, it is classified as a fluent aphasia, which means that people can speak or write readily, even though some of the words they produce are incorrect or don't make any sense. They also tend to have more difficulty understanding language. In addition to that, it has unique characteristics that can help you differentiate it from other types of aphasia. The first one is that they talk a lot, even though it's hard to understand what they're saying. It is even sometimes called jargon aphasia because they produce non-words, or neologisms, which means they create new words. An example is saying, "Bring me a trunket," instead of, "Bring me a drink." They may have logorrhea, or overly fluent speech. It's as if they're driven by an urgent need to say everything at once, speaking faster than average but maintaining their prosody. They usually continue to speak even when the listener is showing signs they're not understanding, and do not adhere to social conventions about turn-taking. Unlike people with Broca's aphasia who tend to be very aware of their problems, people with Wernicke's aphasia tend to lack awareness of their deficits. To learn more about Broca's aphasia, click here. Another difference is that they preserve their grammar well. In contrast with people with Broca's aphasia, people with Wernicke's aphasia use many functional words like auxiliary verbs, conjunctions, and prepositions. However, what they're saying lacks meaning because they fail to correctly use content words like nouns. For example, did you tap over? In this case, words like did, you, and the are functional words that are preserved and correctly used. In contrast, content words are affected. The first one should be a verb but is replaced with a non-word, and the last one should be a noun but nothing was said instead. Additionally, people with Wernicke's aphasia produce a lot of paraphasias. Paraphasia is an error where the person fails to correctly say a word. This error can occur in many different ways. In the case of Wernicke's aphasia, semantic and phonemic paraphasias are common. Semantic paraphasias involve substituting one word for another. An example is saying ear instead of nose. And phonemic paraphasias involve substituting one or more sounds in the target word. For example, someone saying vegetable instead of vegetable. Another notable characteristic is the presence of perseveration or perseverative paraphasias. This means that a previous response persists and interferes with the retrieval of a new one. For example, when asked to name body parts, a person might correctly name arm but then repeat the word arm when the clinician points to an ear. Regarding comprehension, in the most severe and early stages, individuals may fail to understand even single words. However, as therapy progresses and the person gets better, their auditory comprehension improves, allowing them to understand words although they still struggle with more complex sentences. In addition to comprehension difficulties, their repetition is affected in a very curious way. They often make many paraphasias and neologisms similar to their spontaneous speech. More interestingly, they might add a word or phrase or use a more complex form than the one given, a phenomenon known as expansion. They also experience difficulties with automatic language. Automatic language refers to words, phrases, and expressions that a person can produce almost unconsciously and effortlessly, such as counting, reciting the days of the week, naming the months of the year, or reciting the alphabet. Although if they receive help, they can produce automatic language. For example, if it's a series of numbers, the examiner can give an initial prompt, such as counting 1, 2, 3, and the patient can continue by saying 4, 5, 6. All of these language difficulties often coexist with other neurological symptoms because Wernicke's area is close to regions involved in other functions. Patients may present with visual defects as a result. Also, when the parietal lobe is affected, they may exhibit ideomotor apraxia, constructive apraxia, acalculia, and cognitive impairment. Since the location of this lesion usually leaves the motor area intact, these patients can continue using their right hand to write, although the content may be unintelligible due to ongoing language processing issues in their minds.